In the beginning, it was a lot. Think about it. This is a disease that we've never seen. And then all of a sudden, worldwide, we're seeing hundreds of thousands of people ill from it. So the pressure was really on to learn and to learn fast.
The year has in some ways gone by super fast in a blur, but it's also felt like 10 years.
I don't think it was until everything started shutting down that we really realized that this is going to be pretty crazy. I think a year ago today, none of us knew that still a year from that point we would be in the situation we were in.
Definitely very nervous and anxious, and scared. I think everybody was scared. There's so many unknowns, so many things changing so quickly.
Extreme fear, so much anxiety, helplessness because we didn't know what to do and we were just trying. You feel like you have a lot of knowledge and a lot of skills as an ICU nurse, and then you realize that it just takes something like this and kind of a lot of things that you would normally resort to kind of go out the window.
When you think of healthcare workers, automatically think of nurses and doctors, and they do amazing work, but there are other people in the hospital every day. There are other heroes in the hospital, and we can make a difference.
The scale of suffering that we've seen is tremendously different than what we're used to. So the sheer volume was incredible, especially when we were at our highest in November. But we say volume, but if you think of that as a person laying in a bed, that is significant. So many people struggling to breathe, requiring ventilator support. So many family members that are outside of the hospital or standing across the street with signs, looking up at the window or talking to their loved ones on FaceTime. That's dramatic.
I personally got COVID back in November, and then ended up in the hospital for 3 days. So I always said I was not that afraid of COVID because young, healthy people have such a better chance of not being as affected by it. But that doesn't come without exceptions to that rule. I just didn't expect to be one of the exceptions.
Everybody else is tired and exhausted with you, and you can see it, and you can feel it, and you can feel the emotional toll that it takes on people that you work with that you love dearly as coworkers, and there are no words to make it better. And so it kind of got to a point where I was like, I just can't anymore. And I talked to my manager and let her know, and I was like, I am just exhausted. I have nothing left to give.
And the amount of care that patients required, it was more than what we'd ever seen before, and in a very condensed amount of time. So it was quite significant, and it's really hard to put into words how painful that can be for the soul.
So I started looking for a different job, and so took a different position away from the bedside altogether. And it's been a good change. I work from home, which is hard to change when you're around people all the time and noise and chaos, but it's been good.
So this year anniversary is very sobering. Facebook does this thing where it shows you your memories, and this time last year we were saying, look at what's going on overseas, and here we are a year later. Yay, we have a vaccine, and there's finally a light at the end of the tunnel, but we also have over 535,000 Americans that are dead. So while I'm very excited about the vaccine, and we're finally about to see our way out of this thing, there's still a lot of grief and a lot of mourning.
I went into medicine to help people. I think everyone will say that. This has been a fantastic opportunity to help people in their most vulnerable time, some of the hardest times that families go through. When I went up to the ICU, I had a number of families who were just struggling with the fact that they weren't with their loved ones, that they couldn't be there. And I think having experienced that isolation and experienced what it's like to be in a hospital bed where you can't see the people you love and you're kind of scared, has helped me relate better to those patients and their families.
It really is, a landmark that I'm still here. I'm here, I'm healthy, that I have loved ones that are healthy. So yeah, I think it definitely is a huge milestone.
I have started talking to somebody about kind of what I went through in the ICU, and I remember her saying to me, have you ever been through trauma? And I was like, well, no, I've never been through trauma. And then she started going down the list, and I was like, oh, you don't feel like that's a label that you have, because you just got up and went to work every day, and you took what was thrown at you, and you did the best that you could with it, and you did it all together. But I think trauma is this label that kind of is so heavy, that has been, but it's certainly true. I think anybody that has been in a hospital that has touched patients in this time has had trauma.
The hope of getting through this and returning to some sort of normal. We're doing our part on the front lines to make sure that we're keeping people alive and treating people. And I get to go to work every day and help people, and that is such a privilege. A lot of people during this time haven't gotten to go to work every day. But I get to keep doing what I love, and I get to keep helping people. And this pandemic has allowed us to really impact lives. And so that's invaluable.